we'll throw a little bit of music and music therapy in there as well. Thank you so much for joining us, and stay tuned for the next episode. Well, hello, Brain Chat family. It is Dr. Mitzi, your board certified neurologist and MS specialist, and my mission is to engage, educate, and empower those affected by MS to become an active part of their healthcare team. Well, I am so excited today to be back on Brain Chat. We've been out of the loop for a couple of weeks here, but we're finally getting back on schedule right before the holidays and talking about a topic that I think is extremely important, and that is cognitive function. And what is cognitive function, you say, Dr. Mitzi? Well, just give me a few minutes and I'm going to tell you. So I have got an amazing guest here today, and you know how we do on Brain Chat. Go ahead and drop in the chat where you are logging in from. I want to hear where you guys are tonight. We've got folks that usually log in from anywhere from California to we've had some folks from the UK, we've had some folks from Canada. So let me see where you guys are logging in from tonight. And I am going to introduce our amazing guest. All right, so I've got Dr. Evelyn Hunter, who's going to be with me tonight. She's an associate professor in counseling and psychology at Auburn University. She earned her doctoral degree in counseling psychology from Auburn in 2013 and her bachelor's degree in psychology from Emory University. She has her scholarship is rooted in an integrated care framework, examining the impact of psychosocial stressors on disparities in autoimmune conditions through the specific pathways of psychological distress. So, can't wait to hear more about that. She owns a group practice where she and her partners provide clinical care to patients with multiple sclerosis and other chronic illnesses. She has been recognized by the National Multiple Sclerosis Society as a partner in clinical MS care and serves on the Regional Healthcare Advisory Board for NMSS. And Dr. Hunter and I met up a few weeks ago at the Consortium of MS Centers in Orlando, where she was presenting some of her research that we also can hear a little bit more about tonight. And I see some folks logging in from Philadelphia. We got North Carolina in the house. We've got Loganville, Georgia. We've got some other folks from Georgia and Stuart, Florida. All right, let's bring up Dr. Evelyn. Hi, Dr. Hunter. How are you doing tonight?
Good. Thank you so much for having me. I'm so excited to be here with you tonight.
Absolutely. Well, welcome to Brain Chat. Very excited to have you on tonight and talk about a topic that I hear about a lot from my patients. So I cannot wait for us to dig into this tonight. All right. But first, tell us a little bit about yourself and a little bit about the work that you do.
Yeah, of course. So as you said, I'm an associate professor at Auburn University, and my bio has some really huge words, but to break it down, I'm really interested in how our psychological health gets embedded in the body in MS, and I specifically focus on working with how that impacts Black bodies. And so my work is really around just understanding what the social experiences are and our mental health experiences and how we can improve our overall health and wellness in MS. And I also own a private practice, Auburn Psychological Wellness Center. I co-own that with a colleague, and we really focus on providing care for patients with MS and other chronic illness. So again, really just integrating that mental health care into the overall MS patient care.
So I know we're talking about cognitive function, but you said something that was really, really interesting and caught my attention. How our psychological health or how our psychological experiences get embedded in the body. Can we just break that down just a few more seconds? Because it's something that, I try to convey to my patients that basically our mental health affects our physical health. And we can't look at our mental health as just something that we can just push off. We have to think about it as just as important as, if we have chest pain or if we have trouble breathing, so talk a little bit about that psychological experience being embedded in our bodies and what that means.
Absolutely, absolutely. Our stress load is something that we feel biologically. So when we carry a lot of additional stress, it we feel that in our bodies in terms of an increase in hormonal changes in our bodies, for instance, an increase in cortisol, and that becomes sort of a part of our overall physical health and aging characteristics in the cells in our bodies. And so when we add chronic stress into the clinical picture in a condition like MS, what we end up doing is exacerbating a lot of what's already happening in our bodies. And so putting that attention and that focus on our mental health and wellness can really aid us in living an overall in our overall wellness in MS. It can really help to prevent some of that stress from embedding itself in our bodies.
Mm.
And I have folks all the time who talk about how they really experience a decline in their mental health synonymously with a decline in their physical health. So if you attend to those things, you can notice how that difference, um, when you are feeling a bit more depressed or a bit more anxious, you're also feeling more fatigued. That cognitive fog that we're going to talk a little bit about today increases, that mental clarity decreases. So, we study that and we look at ways that we can disrupt that pattern so folks can live, whole lives.
I love it. I love it. So we're gonna have you back to talk about just that, okay? But tonight we're talking
That
about
sounds
cognitive
good.
function because I could do a whole show just about that, about stress. All right. So Dr. Mitzi's writing that down, stress. Okay.
Okay.
But let's circle back and let's talk a little bit about cognitive functioning. You mentioned cog fog, but let's kind of take a dial back. So when we talk about cognitive function, right? People with MS having difficulty with their cognitive function. What does that mean? What is cognitive function?
Yeah, that's a great question. So I like to think of cognitive function as all of our brain things. Okay. So that's the way we remember things. It's how much attention we can pay. It's our processing speed. So, how fast we can take in information and do something meaningful with it. It's the way we listen and learn new things. Um, our overall memory, those are all components of our cognitive function. Our executive function, which is things like, self control and emotion regulation, our ability to plan ahead and prioritize the things that we have to do. These are all components of our cognitive function.
Mm, absolutely right. So all of those things, and so you mentioned several things that we know can be affected with multiple sclerosis, particularly. So we know that slowed processing speed is one of the issues that we can see with MS. We also can see a difficulty with attention and multitasking. But what I try to tell my patients is that oftentimes those other issues translate into a memory issue, but memory issues with MS are not quite the same as memory issues, let's say, with Alzheimer's disease or dementia. Can you talk about the memory issues that we see with multiple sclerosis?
Absolutely. So typically, when we talk about memory with multiple sclerosis, we're more talking about the working memory. So that more immediate memory functioning we need. If you remember back in the day when we used to have to memorize phone numbers, right? And
Hmm.
we didn't
Before
have
we
cell
had cell
phones,
phones.
right? We had to memorize those numbers and keep them in our
Right,
head.
right.
Your working memory is really what allows you to remember, for instance, a 7-digit phone number and hold it with you when you're first getting it. And so that's really the memory issues that we see most impacted in MS, to be able to sort of to hold a small set of information and to then use it almost immediately.
Hmm. So let's talk a little bit about some of the things that people, can see from these memory issues. So processing speed, okay, short-term memory. How would that manifest itself, let's say, in the everyday life of someone with MS? Like what types of things could they possibly have trouble with? Because one thing I try to tell my patients, Dr. Evelyn, is that it is not normal for you not to remember what you ate for breakfast and you're like 25. They're like, "Oh, I'm just getting old." I'm like, "You're 20." Even if you're
Right,
40,
right.
these are not things that we should blow off. So what types of things could be symptoms of cognitive dysfunction that people should be paying attention to?
That's a really good question. So I like to think of it, if you're forgetting daily routine things, that may be a symptom of cognitive function dysfunction. So for instance, you know, you put your keys in a place and then an hour later you can't recall where they are. If you're having trouble grabbing what I call grabbing language, so I can't think of the word for waffle, um, even though I'm looking at a waffle or I just had waffles, right?
Mhm.
So grabbing language, that verbal fluency sometimes gets impacted. Remembering
Mhm.
things that are in the daily routine. If you let your dogs out every evening and you forget to let your dogs out, that's something where that may be a cause for concern. So those types of things can be impacted, um, if there may be some mild cognitive dysfunction or cognitive impairment that's creeping in.
Mhm. And so, how do we measure cognitive dysfunction? When should someone say, I think I'm having a little bit of trouble. I should maybe talk to my doctor about this. What would be, kind of issues that would, concern someone to the point where they, should talk to their doctor about it?
That's a really good question. So this is where I sort of want to differentiate cognitive impairment or dysfunction that we really worry about from what some people call a cog fog or a brain fog, where we're just kind of hazy and we don't have a lot of mental clarity. It almost feels like we're mentally exhausted. Um, so those cog fogs, we don't typically worry about as much, but we know the difference because you're still able to function in the same ways overall. It just feels a bit harder. So you're
Mhm.
hazy, you can't think as clearly, you feel tired or fatigued mentally, but you're still able to function primarily. And typically, if you address a rest issue or a stress issue, those cog fogs sort of clear up pretty immediately. Versus what we think may be a cognitive dysfunction or cognitive impairment issue, when is when there's some impairment in those overall life things that are happening. So, not letting your dog out, for instance, when they need to go out every night, might be that's more than cog fog. It's that something is being interrupted. If you begin to have trouble, if you're working, and the daily tasks that you do at work begin to be hard to do to the point that you're not getting them done, that might be an issue. If tasks that were getting done at home, like for instance finances, paying your bills on time, those things begin to be interrupted, that may be a sign of something a bit more serious. Now, Dr. Mitzi, I want to tell you, I really encourage all MS patients to get cognitive functioning as early as assessment as early as possible. And that's because our best knowledge about whether or not there's any cognitive deterioration or any dysfunction that's progressing is if we have some baseline data about where functioning
Mhm.
is.
So,
So
baseline is important.
that is so critical. The earlier you
Mhm.
get tested, the better we're able to say, okay, this is clearly something different from previous performance. But if you don't have baseline, noticing if there's impairment in overall, or if the cognitive dysfunction seems to last longer. I've gotten rest, I've sort of decreased stress, and I'm still having the same issues remembering where my keys are or remembering what I ate for breakfast in the morning. Those are signs to get in and get some evaluation done.
Mhm. So that's a great point, right? So, it's very important to know when to call your doctor. And generally, I tell folks when they're first diagnosed, you might call about everything, and that's okay. Everyone becomes a little bit very hyper aware of their bodies, but
Mhm.
eventually you settle into a place where okay, this is my normal. When I get a little tired, I kind of get like this. When I get exhausted, I get like this. If I get some rest, it gets a little better. But you begin to know that, okay, this is not not my normal. This is like been going
Absolutely.
on for a week or 2 weeks or a month, and I'm sleeping, I'm doing what I need to do, and this is not getting better, or if it's brand new, then obviously you need to contact someone and let someone know what's going on. So you said that it's good for people to get cognitive assessment in the beginning of their
Mhm.
MS. And then, of course, if they're having difficulty, they should also have a cognitive assessment. How do we assess cognitive function or cognitive dysfunction?
That's a really great question. So, there are a couple of ways. There are some sort of mini assessments that we can do just to sort of get an idea of if we need to do further assessment. So, some that have really been shown in research to be really effective at identifying cognitive dysfunction in MS are like the simple digit modalities test, which
Hmm.
is sort of a quick and dirty test of working memory and other executive functioning, that can help us determine where you are versus where you should be. And so, what do I mean
Hmm.
by where you should be? We have some general idea based on your education and your age about where you should score within a range on these types of assessments. And so, um, a psychologist or neuropsychologist can take a look to see if your cognitive functioning is about where we would expect it to be given your education and age. And the symbol digits modality test is great because it's been tested with MS populations. So we're also able to take a look at the norms for patients with MS, particularly. Um, and then, if for some reason there's something unexpected found, we can do more intense neuropsychological evaluation, both brief and extended neuropsychological batteries to identify specifically where deficits might be. So, what parts of your cognitive functioning might be impacted, and folks experience cognitive dysfunction in a lot of ways. So, some folks have, great working memory, but they have really slow processing speed, or they're able to, hear and retain information easily, but they aren't able to pay it, attention past 10 minutes. And so neuropsychological and evaluation can really pinpoint where the cognitive dysfunction is, and then that will help us develop some strategies to really address what's going on.
I love that. And we're going to come back to strategies. But the other thing that I like to talk about, and we can circle back to stress, is that often stress and mental health conditions such as depression, anxiety can affect our cognitive function. And so, one of the things that I try to stress to my patients is that everything is connected. If you're not getting enough sleep, if we're putting you on medications that make you drowsy, if you are, extremely stressed out, if you're depressed and that's not being treated, or anxious and that's not being addressed, those things can all affect cognitive function. And so it becomes this snowball effect where you
Mhm.
have, let's say, this much of an issue, but maybe only this much is from the MS. And when you add the lack of sleep, you add the stress, it becomes this much of an issue that interferes with your daily activities. How do we kind of sort out what's what, and how do we address those issues? Because one of the biggest concerns when people come to me is, Dr. Williams, my MS is getting worse. I can't remember anything. And I'm like, well, wait, let's see what other things are going on, and let's see how we can address these things. How do we kind of, sort all of that out? And then how do we address those other issues to really get an idea of how much of the cognitive issues are related to MS versus other things?
That's a really great question. So one way is that comprehensive neuropsychological assessment that we talked about. So a comprehensive assessment is going to also look at what we call psychodiagnostic comorbidities, which is just a
Mhm.
big word for, is there depression? Is there
Mhm.
anxiety?
Mhm.
Is there an ADHD issue? It can look at the other um, psychological categories that might
Mhm.
also cause cognitive dysfunction. And so that comprehensive assessment is going to be able to tease apart, it's going to be able to answer the question, is there cognitive dysfunction? Yes, no. But it's also going to be able to answer the question, what else is there?
Right.
And so one of the first lines of defense is to go after the what else is there, right? So if we
Right.
see that there's untreated depression, well, we have some really effective methods of treating depression, both with medication, um, but also, antidepressants, but also with cognitive behavioral therapy or other
Mm-hmm.
types of psychological therapies that are effective at treating depression. And so what we can do then is treat those comorbidities and then come back to the cognitive assessment and say, and now we have what? Baseline. And
Right.
so we can say, now we can look at the cognitive functioning and see if the treatment of these other comorbid issues have helped or if we're still seeing the same levels of dysfunction. And that sort of gives us an idea about where the attributing factors are.
Hmm. Yeah, that's really good, because everything winds up being all mixed together. So, I often have people who come in, we can tell kind of cognitive dysfunction that's more related to MS, where they're starting to have difficulty with their job. But then I've got some folks that come in and is like, I can't remember my husband or I can't remember my best friend's name. And I'm like, I don't think that's the MS. Like,
Yeah,
we just diagnosed you last week. I don't think that's MS. Let's see what else is going on top of this. And so I think
absolutely.
that that's important, and it's also a little bit reassuring, because it again, everything is not 100% the MS. There are other things that we can explore and probably treat, that can be related to that. And insomnia is another big one where people have chronic insomnia, especially if they're depressed, they're not sleeping, they're sleeping 3 or 4 hours a night. And I'm like, honey, you're not going to be able to think straight if you're only sleeping 3 or 4 hours a night for several months at a time. So sometimes it takes a little bit of time for us to
Mhm.
work through some of those other things. But those other things are a little bit easier to work on than trying to fix the MS, so to speak, which is a little bit harder to
Absolutely.
work on.
Yes. Dr.
Yeah,
Missy, that sleep hygiene is a huge, I mean, the sleep
it's
hygiene research is strong. Like
yeah,
you
yeah.
get good sleep and a whole host of things in your body line up. And so,
Mm, mm.
absolutely.
Yeah, so sleep is important. I used to say
Sleep.
sleep is for suckers when I was young, but that is not true. I used to say sleep is for suckers, but listen, you've got to get sleep. Your body needs it, your brain needs it to retain
Mhm.
memories, all of that. Okay. So that's going to be hugely important to cognitive function. All right,
Absolutely.
perfect. So now let's talk a little bit about what we can do to help cognitive function. So, of course, we talk about the problem, but I also like to
Mhm.
talk about solutions, right? So there's this big push in the neuroscience community to talk about brain health, things that we can do to keep our brains as healthy as possible, to keep our brains active. What can people do to, maintain cognitive function that they have? And what
Mhm.
can they do to help remedy or help deal with cognitive dysfunction that they have?
Yeah, I love this question because the one is this is like wonderful news. There are things you can do, right? And sometimes,
Yay!
right, we get excited about this. So I want you to think of your brain like a muscle,
Mm,
And so when we're answering the question, what can we do to maintain or regain cognitive functioning? It's the same thing we would do with any other muscle in the body to maintain or regain functioning. We work it out.
I
So,
love it. Work out
yes,
your brain.
work out your brain. And there are a whole host of fun ways to do that. So, anything that stretches your brain a little bit is going to be healthy for you. So, if you like crossword puzzles, if you like to read, there are a ton of apps where you can play games on your phone. Lumosity, uh, um, there's like a cog fit app that have little different games that you can play.
Mhm.
If you like that words with friend game, I always lose, so I hate it. But if you
I
like it,
always lose. I'm so
man,
bad
they
at words
they
with
whoop my
friends.
tail on words with
I'm
friends
telling you, I get beat
consistently.
every time.
um,
I
so
thought I knew a lot of words.
you feel smart till you get on words with friends. All of those things are going to be good for our brain health. The other
Mm,
things are the general wellness things that help our bodies overall. So there's strong research for physical exercise in our cognitive health
mm,
being
mm.
helpful. So getting out there and doing that 30 minutes a day that's recommended is going to help improve cognitive functioning. We already talked about sleep. So those are all things that are going to maintain and sort of keep you where you are. And then the research around regaining cognitive functioning is baby, right? So it's just starting, but there's some things that show some promising things. So one is cognitive behavioral therapy. So again, learning strategies to link your mind or the things you think to your feelings to the ways you behave can be strong. Strong in terms of helping you to regain some functioning. There are also some other psychosocial interventions. So education can be a great way. So if there's something that you've always wanted to learn, um, grabbing a short, lesson online can be something that just works out your brain. So anything where you're cognitively stretching, an active mind is a healthy mind.
Mhm.
Going
So
out
that
and
means
socializing.
So that means we should not just lay on the couch and binge watch Netflix. We should be doing other things, picking up a new hobby for some people, a
Mhm,
language, an instrument, um, you know, pottery.
mhm.
I tried macrame. That wasn't my thing. But picking up, my mom's a genius at it, but that was not for me. I'm not very crafty. But picking up a new hobby, right?
Yeah.
All of those things are extremely important, and you're
Mhm,
never too old to start or try something new. Even if you try it and maybe it's not for you, at least you tried something different and kind of got your brain to stretch in different ways. So I
absolutely.
really like all of those ideas. And
And
so
it's
when we
full
talk,
circle. Oh,
go
so
ahead,
I
go
was
ahead,
going to
Doctor.
say it's full circle, Dr. Mitzi, because when we try those new things, it causes some stretching. And often that stretching can feel a little frustrating. And then
Mhm,
we use our executive function, which is that self control and emotion regulation, to manage that frustration while we're learning that new thing. And so
mhm.
we're working multiple types of cognitive function in that. Um,
In that, I love it. I
yeah.
love it. And we will take a pause here. If anybody has any questions, please feel free to drop them in the chat. Any questions about cognitive function? We're talking about stretching those brains, working out those brain muscles to preserve our brain health, and do what we can to make sure that everyone is living their best lives with MS. We've got an amazing guest here, Dr. Evelyn Hunter, talking about all of this great stuff from her knowledge and from her practice. Let's circle back to stress. So while we're waiting to see if anybody has any questions, let's circle back to stress because I think
Okay.
this is a really, really big one
Mhm.
that I see every day in practice that really significantly affects people's cognitive function. And, people can be very hesitant to say they are depressed or anxious. But
Mhm.
if I say stressed, they're like, yes, I'm stressed. I'm stressed. But they're showing very classic signs of other mood issues such as depression or anxiety. How do we
Mhm.
kind of tease those out? And how do we address that stress piece, which really affects cognitive function?
That's a really good question. And I see this a lot too. There's a lot of
Mhm.
stigma around depression or anxiety, and a lot of stigma around, for instance, going to therapy or seeing a psychologist.
Mhm.
Um, One of the things that I really tell patients is that the name is not important. Whether we call it stress, whether we call it depression, whether we call it anxiety, if there's something that's interrupting us living our best lives, we want to address it.
I
And we
love it.
typically don't tell people not to address physical things, right? So we
Right.
don't feel ashamed if somebody says, I have a cancer diagnosis and I need to go and receive some treatment. And so we want to think about our mental health in the same way, that it's an important part of our functioning. And no matter what we call it, it's important for us to live our best lives to address it. But stress is, go ahead.
No, no, no. You go ahead.
Okay. We really differentiate stress from sort of the more clinical diagnoses like clinical depression or a clinical anxiety in terms of how it impairs our functioning. So, stress is that sort of heavy sitting thing on our shoulders that makes us feel sluggish and down throughout the day and kind of, or, it resides in our chest as anxiety, but it doesn't interrupt our ability to do the things that we're doing on a day to day. If something's interrupting your ability to do the day-to-day things, it's definitely something we want to get treated. But
Mhm.
stress can often be treated at home by doing those things that bring us wellness. So the first thing I say is that we want to have a wellness practice, meaning what's
I
the
like
thing
that
you
idea.
do every day that brings you peace and brings you joy? Where is your stress alleviated during the day? And we want to be intentional about our wellness practice so that it doesn't get lost in the sauce, if you will. We don't want to lose it when things get high. So, um, a lot of people have exercise as a wellness practice. It's not mine. I don't like exercise. I do it because my body needs it, but that's not where my stress is relieved. Okay.
Tell the
So,
truth, shame the
right.
devil.
Exactly. Right. So you want a wellness practice where your stress is relieved. When you take that deep breath, that's a wellness practice. So for me, bubble baths are a great wellness practice because I can take a deep breath. It's relaxing. I feel calm. Things are quiet. So thinking about what's my intentional wellness practice that I can go to every day to relieve my stress. And then we also want to think about the stress we're carrying that doesn't belong to us. So a
Mm,
lot of times we carry things, um, especially my patients with MS, I see, I wasn't able to get my whole house cleaned. And so now I'm carrying the stress of needing to clean my whole house, even though I'm feeling fatigue and I'm feeling, um, I had a rougher day. I'm now stressed because I didn't get this done. And sometimes we need to be able to let go of those things that don't belong to us so that we can decrease our overall stress load, knowing that you'll feel better in the long run if we kind of let go of that additional stress that we carry, not because someone's asked us to, but because we choose to. So those
mm.
are a couple of things that I suggest.
Yeah, I love that. I love that. Not, the stress that we're not supposed to be carrying. And sometimes it's expectations that we have of ourselves that other
Yes.
people could care less about. I realize that, oh my gosh, if the dishes do not get done every night, the world is not going to end. But there was a time when I thought the world was going to end if my
Hmm.
kitchen was not 100% spotless. So imagine you're also living with a chronic disease that affects your ability to function and you're trying to do your regular daily activities. Sometimes we put too much pressure on ourselves, and we have to take some of that pressure off of ourselves, and give ourselves some grace. That's my favorite phrase, is that you
Yes.
have to give yourself some grace. It absolutely does not have to be done all the time, and the bottom line is that wellness practice. I love the way you say having that wellness practice, because if you do it on a regular basis, your body gets used to doing that. And so you have to carve out that time. For some
Hmm.
people, it might be 5 or 10 minutes, right? So I am a
Hmm.
big fan of meditation. As a matter of fact, my next
Hmm.
show in a couple of weeks is going to be about meditation. So meditation has really changed my whole life. And so
Hmm.
all I need is like 6 minutes of deep breathing, right? And it would turn my whole day around. And I actually have a meditation chair that I sit in my front room, and when my kids come in there, they know that mommy's meditating. And either don't talk to mommy, or you can sit in mommy's lap and meditate too. Those are the two choices.
Those are
Either walk
options.
away or sit down and meditate too. So sometimes they'll sit on the floor and they'll want to meditate, and other times they'll just walk away. But you have to have those things, and it does not have to be 5 hours. It doesn't even have to be an hour, but just carve out that little bit of time to do something for you. Read a devotional. If you're a
Hmm.
person of a spiritual background, pray, but
Hmm.
just find that little bit of time for yourself, and that will help release some of that stress. And then maybe on, a basis of like a week, or, weekly or monthly or quarterly, you can do something really big, but
Right.
those little things really make a difference on an everyday basis. So
Absolutely. And
I
if you're
really like that.
struggling to find what that stress management or intentional wellness practice might be, or you're struggling with those expectations, that's a great place for therapy too. A lot of folks
Mm,
think I have to be diagnosed with something to go see a therapist. No, you don't. A therapist can help you work through the way your mind is working
mm,
to prohibit you from taking care of yourself. And so if
mm.
you're noticing, like, I really want to take care of myself, I really want to treat myself better, but I'm just having trouble doing that, go talk to someone and they can help work through what might be the barrier there.
I love that. And then the other thing is, I tell people when they talk about, seeing a therapist, I'm like, listen, you're going to the doctor. Nobody's going to know unless you walk around with a sign on your forehead saying, I see a therapist. I mean, you know, listen, we have to take care of our minds, because we
Yes.
cannot take care of other people unless we're taking care of ourselves. And so I think if anything, the pandemic has really brought so much attention to mental health because people have
Mhm.
really had difficulty struggling
Yeah.
with anxiety, depression, things like that due to everything going on. And I mean, it is hard to get an appointment with a therapist right now
It
because
is.
everybody is booked out, so if there's anything good that's come out of it is that people are, I hope, paying more attention to their mental health and realizing that it needs to be addressed in a very real way. But yeah, we kind of got off on a sidebar, but I think that's really important, for people to hear, because as I said, stress is so key to our cognitive function, as well
Absolutely.
as sleep. And then let's talk a little bit about the ways that cognitive function is becoming more prominent, I would say, in terms of the MS research world. So,
Mhm.
cognitive dysfunction is one of those things that we've known happens with MS,
Mhm.
but we often, even myself as a expert in MS, we often catch it too late. And so it's kind
Mhm.
of like we don't catch it until people are already in trouble. So what are some of the things, some of the innovative things that people are doing to try to measure cognitive function so that we don't, get it after the horse is already out of the barn, so to speak, so that we can catch it early and so that we can address it and potentially change people's treatment to make sure that we delay it and keep it from getting worse.
Yeah, that's a great question. There was a review in the research about 10 years ago that said, hey, cognitive dysfunction is something that, more than half of folks with MS experience, and we don't have any good research on it. And it really called attention to the need to not only find um, valid measures of cognitive function, but also measures that could be done quickly in the
Right.
context of an early neurology visit, and also measures
Mhm.
that could be done um, from home. And so, one of the things Cleveland Clinic has the brain health measures
Mhm.
that are digital and accessible for patients from in the context of their own home. Again, that symbols digit modality test has been tested now in recent years and is extremely effective. Um, so there's been attention paid not only to how we assess cognitive function, but now more recently to now how do we address cognitive dysfunction in MS? And that's where we're seeing the research really move now. So we've seen research come out recently around exercise and cognitive dysfunction. We've
Mhm.
seen research come out that looks at specific mindfulness based stress, for instance, mindfulness based stress reduction as a means to limit stress and then hopefully repair cognitive function. We're seeing that research come out. So there's a lot of really things coming on the forefront around how we address cognitive function. But the biggest thing I'll say is that as a patient, take agency, talk with your healthcare team. If you're having these experiences, reach out to folks. Use some of these at home strategies so that as the research develops, you're sort of at the front line of being able to access some of those strategies. Um, and again, get your healthcare team together before you need it. So that therapist thing is so true. They're booked up. Book one now. Get on the books for 4 months from now, even if you're feeling great, so that just like any other healthcare provider, you have a provider that you can go to see if that's a need that becomes important.
Yeah, so I think everybody can use a therapist. So whenever I
Yes.
first diagnose somebody, I'm like, we need to get you a therapist. I think, you know, um, dealing with the regular stresses of life and then dealing with the diagnosis of MS on top of
Mhm.
that can be a lot more than people anticipate. And
Mhm.
so I always tell someone, I often tell my patients when I'm in clinic, if someone else were to walk up to you and explain the situation that you're in, right? And to someone else, you would say, oh my God, how are you making it? You need some help. But when it's you, you say, I'm Superman or I'm Superwoman, no problem, right? And so we could recognize that someone else who had those exact circumstances would probably need some additional help. But when it's us, we feel like we could just push through, and so it's okay to get that help. And again, that mental health affects every other part of the body, especially when you have a chronic condition like MS. So we have to address it just as much as we address those physical symptoms like numbness, tingling, all of that stuff. Okay. So it's
Absolutely.
equally, if not more important than those other symptoms. So I see that no one has any questions in the chat, which is fine. I see a lot of great comments that people are receiving the information. And I'm glad that everyone logged in. Do you have any parting thoughts for us, Dr. Hunter?
Um, just get that intentional wellness plan. Um, be attentive to that brain activity. You know, like I said, an active brain is a healthy brain. So get out there, do things, learn new things, read new things, play games, and yeah, that's all I have.
Awesome sauce. Well, thank you so much for being with us today. So, everyone has homework. Get a therapist if you don't have one already. Make that appointment for 4 months from now and
Mhm.
learn something new. Stretch those brains, get those brain cells moving with that new activity. Oh, I do have someone that has a question in the chat. Someone asked, will journaling help with cognitive?
Absolutely. Yes. Writing, which we're called, you end up recalling. So that's memory. And then also when you reread that, you end up rehearsing. So again, two memory strategies. Absolutely. Journaling is great.
Awesome. All right, everyone. So I'll be looking forward to hearing about that homework. And stretch those brain muscles, stretch those neurons, those synapses, all that good stuff. So thank you all so much for logging into Brain Chat tonight. Meet us here in 2 weeks. We will be talking about one of my favorite subjects, meditation and mindfulness. Thank you so much, Dr. Hunter. All right,
Thank you
guys.
for
Have a
having me.
wonderful evening.